right, today's lesson, the endocrine system. So endos within, crine means to secrete. So we will be secreting within the body. So these are your hormones. So you got glands, that's epithelial tissue. So remember, skin and its skin structure is epithelial tissue. And all it does is it turns on other parts of the body. That's all a gland does. So it's a chemical messenger using hormones, and we have two types, fat-based hormones and protein-based hormones. So here are our main glands, but these aren't the only things that make hormones. So other parts of your body, they make tons and tons of messenger hormone-like chemicals. So I'll quickly go through these guys, and don't get bogged down with the functions. That's not this class. So in your anatomy class, you're gonna have to link what makes what, does what. Here, just recognize the names and the terms, right? Because we're medical terminology, not anatomy. So pituitary, that's your master gland. So that's at the base of your brain. So right behind your nose, we'll see in the image. Above it is the hypothalamus. So the pituitary is just right below. In fact, that is the pituitary right there that they cut off. Thyroid's in your neck. Parathyroid, para means next to, so embedded within your thyroid are your parathyroid nodules. We usually have 4. What are your renals? Those are your kidneys, right? So your adrenals are the glands that are right above it. They're added to the renals, so they're called the adrenals. The pancreas sits right behind the stomach. That's for digestion and hormones as well. Mostly insulin. Pineal gland. So this is in the back center of your brain. So sleep, wake. And then the gonads, male and female. And then lastly, your thymus, which sits right above your heart. And that's involved in your immune system. So that's a basic overview of the glands, the major glands. So let's talk about the different parts. Again, you don't have to memorize everything. Just be familiar with the names. So you have the thalamus. Below the thalamus is hypothalamus. Hypo for below. Neuro. So your pituitary has 2 parts. Right? So it's going to hang down. There's an anterior part and a posterior part. So the posterior part is more nervous tissue. So they call it the neurohypothesis. So if I say posterior pituitary, it's the same thing as the neurohypothesis. So 2 hormones, antidiuretic hormone. So if you take a diuretic, it causes you to lose water. So antidiuretic hormone makes you hold on to water. Vaso, your blood vessels. Vasopressin, that's going to increase blood pressure. So it's going to cause your blood vessels to constrict. And the last thing it makes, melanocyte, stimulating hormone, which is pigmentation. Melano means black. Cell, so your pigment cells. Adeno. So you have the posterior pituitary, and then you have a front portion, which is the anterior pituitary. So it's more glandular, so they call it adeno. Right? The term adeno means gland. So this is a more gland-like structure. Anterior pituitary, same as the adenohypothesis. And this one's going to have tons and tons more hormones. And this part of the pituitary is called the master gland. Right? So from the pituitary, it's going to send its hormone to the target organ. So if it's going to the gonads, right, it's going to tell the ovaries, hey, start making eggs and estrogen. If it goes to the testes, start making sperm and testosterone. So if this goes to your thyroid, it's going to turn on the thyroid, and the thyroid makes its hormone, thyroid hormone. So the pituitary, it just turns on the other glands. All right, so from the pituitary, you have thyroid stimulating hormone. So the name of the hormone tells you what it does. So the pituitary releases thyroid stimulating hormone. It goes to the thyroid, and then it causes the thyroid to release its hormone, which is just thyroid hormone. Right? So the pituitary turns on the thyroid. So that's its first hormone, is thyroid hormone, aka thyroxine, triiodothyronine. So it's just different names for thyroid hormone. And what that does is it regulates your metabolism. So if you have too much hyperthyroidism, you're going to be very skinny. If you don't have enough thyroid hormone, hypothyroidism, you're going to tend to gain weight. Slows down your metabolism. The second hormone is calcitonin from the thyroid, and that helps regulate calcium in the blood and body. So calcitonin takes calcium in the blood and puts it in the bones. So it helps build strong bones. If you have osteoporosis, thinning of the bones, then we may give you calcitonin to help stimulate calcium from the blood getting embedded into the bones. What does para mean? Next to, right? If you're a paraprofessional, you're going to work next to professional. So it's embedded in the thyroid, and people usually have 4 nodules, but sometimes people might have an extra 1 or 2. So that means they're going to have too much parathyroid hormone. So parathyroid hormone does the opposite of calcitonin. It takes calcium from the bones, dissolves the bone, and releases it into the blood. So those 2 hormones, they're going to balance each other out. So calcium is important in your blood. If you don't have enough, muscles can't contract, your blood can't clot. Medulla. So that's the center, right? Cortex means the outer surface. Medulla means the middle. So think of M for middle. So it's just only one function in the cortex, and think of adrenaline. So does adrenaline speed you up or slow you down? Speed you up. So that's for flight or flight. So if there's danger, either you stay and fight, so it's going to prepare your body to fight. So heart rate goes up, breathing goes up, vision goes up. You might have to release your bowels, right? Because you can't digest and fight at the same time. The cortex. This is going to have multiple functions. So this is going to be the outer surface. So it has three layers in the outer surface and 3 functions. One is regulating your metabolism. So glucocorticoids, just think of sugar. Corti means it's from the cortex, right? Makes sense, right? Makes it easy to know. So you know where this hormone comes from. Mineral. So when you regulate salts and minerals, you're going to regulate water. So this one is metabolism. This one is water balance. And then lastly, gonads. What are your nads? That one's for sexual growth. So the name of the hormone tells you what it does. Right? Sugar, well, that's going to regulate metabolism coming from the cortex of the adrenal gland. If it has to do with minerals, right? Think of salt and water from the cortex of the adrenal gland. And then lastly, gonads, those are your testes and ovaries. So the cortex hormone will stimulate them. What region is your pancreas in? Which of the 9 region? They're like, I don't know. It's behind your stomach. So if you said like epigastric, or if you said, what's this side? Left hypo, H-Y-P-O, chondriatic, then you'd be right. It's right behind the stomach, right here. It has two functions, exo and endo. So here we're going to talk about the hormones. Its exo function is for digestion. And the difference is, here we have a duct, right? There's a tube or a blood vessel or a sweat pore that directs the contents to the outside. Whereas endo, that's going to be for insulin and glucagon. That's going to regulate your sugar. Insulin tells your body to lower blood sugar. Glucagon tells your body to increase blood sugar. So they work together to balance out your blood sugar. The pineal body, sometimes it's called the pineal body. So it's in the back of your brain. A couple functions we'll talk about. Melatonin is your pigment protein. So melanin is black. So it's going to stimulate tanning, production of melanin, and also, scratch that. Melatonin is the hormone for your sleep-wake cycle. Sorry, not your pigmentation. That's melanin. This is melatonin. That's for your sleep-wake cycle, and it responds to light and dark. So as it gets darker during the day, your pineal will release melatonin, and it'll get you sleepy. But nowadays, what do you guys do right before bed? You look at a nice bright screen, right? So make sure you put on your blue light filter, because that's going to stimulate you staying awake. It's not going to allow your pineal gland to release melatonin. So we stay up later and later. What time is midnight? Why aren't you asleep yet, right? It's supposed to be in the middle of the night. But now we stay up 11, 12, 1, 2. The gonads, I'll reserve this more when we go over the reproductive system. So estrogen, that's your female hormones. Progesterone, those are male hormones. It's just that they're in the female body, so we call them progestins. So ladies, you literally cycle between estrogen, so day 1 through 28 of the cycle, you have a lot of estrogen, and then somewhere in the middle it dips down. Progesterone, the male hormones, very low at the beginning of the cycle, and then it increases. So I'm super simplifying this, but you guys are cycling from your feminine state and your male state every month. The males, testes, outside the body for the best temperature. Androgens, what does andro mean? Miley Cyrus has an androgynous look with her short hair. She look like a man, right? So andro means men. So the male hormones are androgens. Right? So if you ever seen those commercials to increase testosterone, androgel, right? You ever heard of that? Androgel, andro 5000, things like that. So the main male hormone is testosterone. Do men have estrogen in their body? Yeah. You guys have both male and female hormones. It's the balance of it. Men have both male and female hormones. So what happens if you remove the testes? Testosterone falls, estrogen stays the same, so you become a woman. So men who have their testes removed from testicular cancer, they'll start developing breasts, right? Because there's no testosterone to counterbalance the estrogen. If you're an athlete and you abuse testosterone, right? Where are you getting your hormones, your testosterone from? From the outside, right? So is your body making any testosterone? No, it doesn't have to. You're getting it from your injections, right? So what happens if you quit testosterone? What happens to your testosterone level? It stays low. You pretty much become a woman because you abuse your hormones. So a lot of athletes who go off testosterone, right, their body's going to change. They're going to look more like women. Their testes haven't adapted, recovered yet. What if you're a West German Olympian? If you're a female West German Olympian. Remember when they used to have East Germany and West Germany, right? So they were given vitamins, all the female athletes. I think it was East Germany. They were all given vitamins, but they're actually testosterone. And a lot of these women, they only feel comfortable now living as men. You ever heard of Russia and their state-sponsored steroid use? So the Sochi Olympics, every Russian athlete was pretty much dirty. And if you want to watch the movie for that, it's called Icarus. This guy, he did a race, he did a cycling race like the Tour de France without drugs. And then he hooked up with the guy in Russia that did all the doping, and he did all the drugs he can, and he did the next year's race all doped up. But he beat all the tests. So Lance Armstrong did the same, 7 years in a row. Thymus. Where's your thymus? Point to your thymus. Where did I say your thymus was? Right above the heart. Right? So it makes immune cells, thymucin, other immune cells. When you're a kid, do you have a good immune system or a bad immune system? Brand new baby. No, it's actually really, really, really strong. The only thing is, it's dumb. Right? It's a dumb immune system because it hasn't experienced the world yet, right? It's only once you're exposed to stuff that your immune system becomes smart and it's more specifically targeting pathogens. So as a kid, you have a gigantic thymus gland that just produce generic soldier cells, immune cells that protects the child. To further protect the infant, breastfeed them. You get antibodies through the breast milk. T cells, that's what HIV attacks, are your T cells. And B cells, those are your memory cells. When you get a vaccine, we're trying to stimulate the memory cells. So you remember, hey, this is what my body needs to attack next time. All right, let's get into the terms. So aden, that's gland. So remember adenohypothesis, that's the anterior pituitary. Added to the renals are your adrenal glands. So just look out for the R, adren. Glucose, glycogen. So glucose is usually just one sugar by itself. Glycogen is a bunch of sugars linked up together. So it's a complex carb. Your nads, aka gonads, right? Pancreato. So a lot of these terms are easy. They're just abbreviations or shortened of the gland name or term. Easy enough. Parathyroid is parathyroidal, thyro, or thyroidal. Makes it easy. Here's an image of the hypothalamus and the pituitary. So what's above the hypothalamus? The thalamus, right? So below means hypo. So below the thalamus is the hypothalamus. So the hypothalamus acts as the bridge between the nervous system and down here is the endocrine system. So the posterior portion, it's more nervous tissue, so they call it the neural hypothesis, whereas the anterior is more glandular, so they call it the adenohypothesis. So right here, through your nose, if you have an issue with your pituitary, they'll like to do surgery through the nasal cavity. So hypothalamus, right below the thalamus. So it can override the immune system. Remember, it acts as the bridge between the nervous system and the endocrine system. Pineal, these are just review. Melatonin, and then sexual development. Thyroid metabolism, and also calcium regulation with calcitonin. Thymus, HIV attacks your immune cells, T cells, and then B cells are your memory cells. Here's your thyroid in your neck. What's your larynx? Voice box. Because when you get laryngitis, you lose your voice. So here in your neck, there's a lot of blood vessels, nerves, so the surgery is going to be very delicate. The parathyroid, the surgeon can't tell the difference. Here in the image, they colored it nice and dark, so you can differentiate it. But if the surgeon's just cutting around, right, it all looks the same. All glandular tissue kind of looks like mush. So most of us have 4. Some of us might have extra nodules that may be producing too much parathyroid hormone. And again, parathyroid hormone takes calcium from the bones and puts it into the blood. Added to the renals, so the cortex, 3 functions. The medulla, only 1. For us, that is epinephrine, flight or fight. Pancreas, ovaries, and testes. So insulin responds to sugar. So when you eat, your blood sugar is going to go up. Do you guys know what normal blood sugar is? So you should be relatively low. So you want to be towards the lower end. And this is at all times. So right after you eat, your blood sugar is going to spike. After an hour or 2, your body's going to release insulin to tell the cells to use the sugar. So it lowers the blood sugar. However, after eating, if your blood sugar stays high, then that might be the sign of diabetes. So either you're not making insulin or your body's no longer recognizing insulin. Female hormones, male hormones, and then the testes make testosterone. Pancreas, both exo for digestion and endo for sugar regulation. So when you eat, your blood sugar goes up, and then your body releases insulin. Insulin tells all the cells, your liver, to use that sugar that's in the blood. Now, if you're exercising, right, your body's going to use up all that sugar in your blood. So your blood sugar goes down. Let's say it goes down to 50, 40, right? What happens when you have low blood sugar? You get a little, what? Dizzy? What else? Huh? Weak? Clamminess? You get the shakes? And you get a little angry as well? A little irritable? Yeah. So what your body does, it releases glucagon. And it tells your cells, your liver, hey, if you have sugar, please put it in the blood. Right? Hopefully that increases your blood sugar. And then you're no longer hangry. On the islets of Langerhans, you have alpha cells that produce glucagon. Beta cells produce insulin. Sugar's bad. Sugar everywhere in your body. Cretinism, deformed thyroid gland or missing at birth. So severe birth defects. Graves' disease, again, thyroid issue. You're going to get accumulation of fat or redistribution of fat in different parts of the body. Notice the eyes. What's up with her eyes? They're kind of bugged out a little bit. Sometimes there's fat that grows behind the eyes and it pushes it out. Exophthalmic. Goiter. So either you're not getting iodine or your body's not absorbing it. So your thyroid compensates. Hey, I'm not making enough, so I think I need to grow bigger to make more. Or, hey, I'm not absorbing enough iodine. I need to grow more so I can absorb more. So it could be caused by too much or too little. So goiter is non-cancerous. Usually just iodine replacement will help it. Where do you guys get iodine in the diet, in your diet?
Salt.
Where?
Salt.
Yeah, ionized salt. So that's why they put iodine in salt, because people who don't eat a lot of seafood, because that's where a lot of iodine is in your diet, they're going to be deficient. So if you live on the West Coast, probably seafood. Live on the East Coast, yeah. Live on the third coast, right? Southern coast, you're probably going to incorporate a lot of seafood and iodine. But if you're in the Midwest and the center, you're going to have to sprinkle on the salt. All right, got inflammation of the pancreas. We have a blood condition where there's low sugar, right? Anemia is a blood condition. Hypo is low. Gly is sugar. So you have a blood condition of low sugar. Diabetes mellitus, is that sweet or not sweet? It's sweet. Remember, insipidus is tasteless. If you want to put somebody down, call them insipidus. Right? You're tasteless. Want to call them sweet? Call them mellitus? I don't know. Doesn't roll off the tongue. Type 1, you are no longer making insulin. So for the rest of your life, you got to inject insulin. Anytime you need sugar, got to inject it. So that means your beta cells were probably all killed off somehow. Sometimes it's your own immune system that attacks them. Type 2, now in America occurring earlier and earlier. That's when you stress out your body. So if you eat a large meal, your body dumps a lot of insulin. You eat another large meal, your body dumps a lot of insulin. And then your beta cell goes, you know what, I'm tired. I don't want to make anymore. So they don't make enough. Also, even if you're making enough insulin, your body may become insensitive because it's always there. Right? You always eat big meals, there's always insulin. Your body goes, forget about it. There's always insulin. So you can lose your sensitivity to insulin as well. So diet. You get to eat a lot of protein, so nothing but steaks. You eat a lot of fat, so go Atkins and avoid carbs. For diabetes, think of slow carbs. So you got to think of things with a very, very low glycemic index. All right, we got sugar in the urine. Here we have damage to, what are the nephrons? Donde? Where are they? They're in the kidneys. Neuro? Yeah. So the blood vessels, the small blood vessels and capillaries at the tips of your fingers and toes, they get damaged, and also the nerves will get damaged as well. Sugar destroys everything. Sugar can coat the back of your eyes, causing blindness. And when you can't burn sugar, your body burns fat and protein. Right? So for these patients, they might go into ketosis, right? Where the body's burning fat and protein and it makes them acidic. Does your blood pH go up or down if you're acidic?
It goes
Down. So if you go below 7.35, so 7.4 is your normal blood pH, but if you go down to 3.75, coma. That is a diabetic coma, ketoacidosis, medical emergency. Okay. Cancer. So hormone cancer is easy. If you have a cancer in the gland, remove the gland, and guess what? We have almost hormones for every gland. So it's not life sentence, except for pancreatic. Few celebrities with pancreatic cancer. You guys know who Patrick Swayze is? Dirty Dancing. Dances with Wolves. I don't know what other dancing movies he have, but he was on SNL with Chris Farley. They did some dancing, Chippendale dancing. So I guess he likes dancing. It's not recording. All right, we'll figure it out. All right, surgical terms. So let's see. Ectomy is removal. Just look for the E for exit. Here we're just removing any generic gland. What are we removing here? The adrenaline gland, right? The adrenal gland. Hypophysectomy. What are we removing here? What's a hypophys? That's the pituitary. Remember? The neural hypothesis and the adenohypothesis for the posterior and anterior pituitary, respectively. Other surgical terms: removal of the pancreas, right? Here we got the removal of the parathyroid, removal of the thymus, thyroid, HRT. So women in their 50s, they're gonna have a decline in estrogen. So depending on their needs, they might supplement estrogen. You guys ever heard of like Premarin, right? Conjugated estrogen? Just a pill and then you'll supplement. And lastly, low blood sugar, hypoglycemic. Human growth hormone. A lot of athletes will abuse human growth hormone. And if you use it as an adult, then it's your ends that get bigger. So their head will get bigger, their fingers will get longer, their jaw will elongate. All right, not too bad. Let's see what time we have. Might be able to squeeze in. Yeah, let's take a break now, and then we'll finish up blood and the other system, lymphatic system.